My goal and the goal of my patients is the same, to have a healthy baby who will thrive. Unfortunately, about 1 in 40 pregnancies that are low risk, something will go differently. What I see as my job and my approach is to evaluate the development of a pregnancy and identify those conditions where something isn't developing quite right, and then make a care plan and maximize the likelihood that everything will end well. It's one of the great pleasures at practicing at a medical center like New-York-Presbyterian, Weill Cornell, to be surrounded by expertise, both my colleagues in the Division of Maternal Fetal Medicine and the departments of OBGYN. With all of our combined expertise, there are virtually no conditions that we might identify in a developing baby that can't be treated here and can't receive state-of-the-art care. I think as a maternal fetal medicine specialist, I care for the mother and I care for the developing baby. We're learning more and more about the development of the embryo and fetus, including anatomically and including genetically. And it's exciting that we are able to identify more and more conditions earlier and earlier in pregnancy. And in some cases that can lead to earlier intervention, different types of interventions that can help improve outcomes. We are learning more and more about ways to prevent maternal mortality, and identifying conditions that can jeopardize maternal health. And imaging can play a big role of that when we can see problems with how the placenta might be developing and identify pregnancies at risk of heavy bleeding. And I'm excited that we can prevent catastrophic outcomes, including maternal death. I can't describe how rewarding it is to see a woman taking home a healthy baby when I know and they know that things could have gone much differently.